The next chapter that we will be discussing right now would be chapter 13, the cardiovascular system. So for the major functions of the system, first, it regulates your blood supply. Second, it generates your blood pressure. Third, it routes your blood. And then four, it actually ensures one-way blood flow. For the heart characteristics, of course, the size of it is as the size of your fist when you close it, and it weighs around less than 1 pound. So the location is found between the lungs in the thoracic cavity, and its orientation, the bottom part or the apex part of the heart, is actually towards the left side of your body. So the heart coverings, you have first your pericardium. So the pericardium is a double-layered sac that anchors and protects the heart. Next is the parietal pericardium. It is the membrane around the heart's cavity. Next is the visceral peritoneum or pericardium. It is the membrane on the heart's surface. And the next is the pericardial cavity, which is the space around the heart. The different heart layers. So first, you have what you call your epicardium, which is the surface of the heart, and it's found outside. In the middle, you will see here the myocardium, which is thick middle layer composed of the cardiac muscles. And then lastly, you have the endocardium, or the smooth inner surface of the heart. The cardiac muscles, first, from what we have already learned before, it has one centrally located nucleus. These are branching cells. They are rich in mitochondria. They are striated with actin and myosin. Its calcium and ATP is used for contractions, and they also have intercalated disc that connects your cells. For the chambers and the blood vessels of your heart does have four chambers. First is that you have your left atrium. Next is your right atrium. Next is your left ventricle, and then you have your right ventricle. And then you have now your coronary sulcus in the middle. So basically, your right atrium and your right ventricle is divided of what you call your tricuspid valve. And then for the division of your left ventricle and the left atrium, you have there your mitral valve. So these valves do actually have the role of stopping or preventing the backflow of your blood. Okay? So the atria. So this is the upper portion holding chambers of your heart. They are small and thin-walled. They contract minimally to push blood into the ventricles. So you have there the interatrial septum, which separates the right and the left atria. Next, you have your ventricles, which are found in the lower portions of your heart. It is the pumping chambers. They have this thick and strong walls. They also contract forcefully to propel blood out of the heart. And then you have the interventricular septum that separates the right and the left ventricles. So this is the surface of the heart for the anterior view. So you would see here that you have your superior vena cava, you have the branches of the pulmonary artery, you have your pulmonary veins, you also have your right atrium, you have your coronary circus, you have your right coronary artery here, you have your right ventricle, and then the inferior vena cava. You have the aortic arch, you have the left pulmonary artery, you also have your left pulmonary trunk, you have your left pulmonary veins, you have your left atrium, the great cardiac vein, the anterior interventricular artery, and then the left ventricle. So this is actually how, or this is an image showing how your heart looks like when it's cut into half. So you will see there the different parts like the trabeculae carneae. You also have the walls of the ventricle. You have your papillaries, subauricularis, your cuspis parietalis, cuspis septalis. You have your aorta, the bifurcation of your pulmonary trunk. You have also your coronary artery here, and then your trabeculae. Okay? So for the valves, what are they? They are structures that ensure one-way blood flow. So first you have your atrioventricular valves between the atria and the ventricles. So you have, the first one is a tricuspid valve or the AV valve between the RA and RV, or the right atrium and right ventricle. And they have three cusps. And then you have the bicuspid valve, also known as your mitral valve. This is the AV valve between the left atrium and the left ventricle. They have two cusps, hence the name bicuspid. And then you can also see there your chordae tendineae, which is attached to your AV valve flaps, and they support your valves. And you have your semilunar valves, which has the pulmonary or the base of the pulmonary trunk, and the aortic semilunar valves, which are found on the base of your aorta. So this is the anterior view of your heart valves. So again, you will see here how your chordae tendineae looks like, the papillary muscles that they are attached in. You can also see there your anterior cusp of the tricuspid valve, and then of course your inferior and superior vena cava and the ascending aorta. And then you also have your pulmonary trunk. And then on the superior view, you will see here your pulmonary trunk, your pulmonary semilunar valve, the opening of your coronary artery, this one. You also see here your opening of the right coronary artery, and then the aortic semilunar valve. You have the bicuspid valve, the left atrium, the superior vena cava, and then the right atrium. So what happens when the bicuspid valve is open? So blood flows from your left atrium into your left ventricle, and then aortic semilunar valve is closed. So this is, or the mitral valve is closed. And then tension on the chordae tendineae is very low. So blood flows from the left ventricle into the aorta. So there, it travels here. And then the aortic semilunar valve is open again. And then tension on the chordae tendineae is high. So here it shows you the functions of the heart valves. Okay, so here once the blood goes in from the aorta, the aortic semilunar valves are closed. And then here you see that you have also blood coming from your left atrium, opening the bicuspid valve. So the tension in the chordae tendineae is low. And then you have your papillary muscles that are relaxed. Of course, your cardiac muscles are relaxed as well. And then the left ventricle is also relaxed. Okay? So the blood flow is like that. So it enters your left atrium, going to your bicuspid, going to your left ventricle, and then of course it would or uh, the division of the left atrium and the left ventricle closes to avoid the backflow of your blood. Okay, and then here you see naman um, how the blood goes in naman kapag sa papunta na siya sa aorta. Okay? So, nagkakaroon ng pagsasara ng inyong bicuspid valve para hindi pumasok yung or mag-backflow ulit. So, it causes high tension with your chordae tendineae. Your papillary muscles are contracted. Your cardiac muscles are contracted, and the left ventricle is also contracted. And then the aortic semilunar valve is open. So for the right side of the heart, you have your pulmonary circuit. It carries blood from the heart to the lungs. And the blood is usually oxygen poor and carbon dioxide rich. Okay? So the right atrium receives blood from three places, including your superior inferior vena cava and the coronary sinus. So the superior vena cava drains blood above the diaphragm. which includes the head, the neck, the thorax, and the upper limbs. And for the inferior vena cava, it drains the blood below the diaphragm, including your abdominopelvic cavity and the lower limbs. And then for the coronary sinus, it drains blood from your myocardium. So the right ventricle, it opens up into your pulmonary trunk, and then the pulmonary trunk splits into the right and the left pulmonary arteries. And then your pulmonary arteries carry blood away from the heart to your lungs. For the left side of the heart, it has what you call your systemic circuit. So it carries blood from the heart to the body, and it is already blood oxygen rich yung inyong blood and carbon dioxide poor. So more likely in the left side of the heart, tinatawag na nating oxygenated yung blood na kanyang dinadala. So the left atrium has 4 openings, including the pulmonary veins that receive blood from the lungs. Siguro magtataka kayo dito, bakit si pulmonary vein ay oxygen rich, 'di ba? As we all know, ang arteries, they usually carry the oxygenated blood, and then veins do carry the unoxygenated blood. But in the heart, okay, there's actually an exemption that the pulmonary veins don't kumbaga, they don't carry unoxygenated. So even if they are vein, they carry oxygenated blood. So this is actually the type of vein that's exempted from the ruling of the arteries and the veins. Okay, so remember that. Next, for the left ventricle, it opens into the aorta. It's thicker and contracts more forcefully. Higher blood pressure than the right ventricle has to get the body. And then the aorta carries blood from the left ventricle to your body. So again, this is actually how the anterior view of your heart looks like. So just be familiar on the different parts of your heart. Okay. So this is now the posterior view. Okay, comparing it from an actual model and from a model that's a drawing. Okay, so that's how you compare them. So, actually, mas madali siyang i-memorize kapag ka-colored. But then again, kapag ka nakakita talaga kayo ng totoong heart, no, you will need to be very meticulous when it comes to observing it as well. Kasi nga, iisang color lang siya. It won't actually say if it's a vein or an artery. So, as long as you know the location and what structures are found on the surfaces of the heart and even inside of it, you should be good. Okay, so if you would like to study how a heart looks like, you can actually buy a pig's heart. Kailangan lang hatiin nyo siya sa gitna to be able to appreciate the different parts that are found in your heart. So basically, a pig's heart is the closest, I think, model that we can have when it comes to studying the different parts of the heart. So, ayan. Ito naman yung kapag kahinatin nyo siya sa gitna, it would actually show you the different parts of it. You have the veins, you have the arteries, you have the valves, the chordae tendineae, and then, of course, your papillary muscles. So, please make sure to study the images on your APR and even on your books to be familiar with these parts. So, the blood flow through the heart. So, first would be from your right atrium, going to your tricuspid valve, to your right ventricle, going to your pulmonary semilunar valve, and then your pulmonary trunk, to your pulmonary arteries, to your lungs, and then to your pulmonary veins, to the left atrium, to the bicuspid valve, to the left ventricle, to the aortic semilunar valve, and the aorta. And of course, the last would be the rest of your body. So that's actually how your blood flow happens through your heart. Okay? So again, this is another representation of how the blood flow looks like. Okay, so this is just a continuous cycle of the travel of the blood in your body. So please make sure that you will at least memorize this one. So the blood supply to the heart, you have coronary arteries. This is the blood supply to the heart wall. It originated from the base of the aorta, which is found above the aortic semilunar valve. And then you also have your left coronary artery, which has three branches. They supply blood to the anterior heart wall and the left ventricle. And then for the right coronary artery, it originates on the right side of the aorta and they supply to the right ventricle. So this is actually how it looks like. So you have there your right coronary artery and you have the anterior interventricular artery. So that's how it actually looks like. Yung mga blood vessels sa anterior view ng inyong heart. And then of course you also have your veins here, like your small cardiac vein, your great cardiac vein, and your coronary sinus. So those are the major blood vessels found in your heart. So, action potentials in the cardiac muscles. So, changes in the membrane channels permeability are responsible for producing action potentials and is called your pacemaker potential. So, the depolarization phase, of course, during this phase, sodium channels open and then calcium channels open as well. And then for the plateau phase, okay, the sodium channels are closed, some potassium channels are open, and calcium channels remain open. So next you have your repolarization phase where potassium channels are open and calcium channels are closed. And in the plateau phase, it prolongs the action potential by keeping your calcium channels open. So in the skeletal muscle, action potentials takes actually around 2 milliseconds. In cardiac muscles, they take around 200 to 500 milliseconds. So mas matagal siya compared to your to the contraction or to the action potentials of your skeletal muscles. So, mas mabilis kapag sa skeletal muscles. Okay? So, this is actually the comparison of action potentials in the skeletal and cardiac muscles. So, as you see here, the difference is that when it comes to your cardiac muscles, there's a plateau phase, okay, before it repolarizes. Compared to your skeletal muscles na depolarization, then repolarization sila. Okay? So for the conduction system of the heart, it is actually the contraction of the atria and ventricles by cardiac muscle cells. So you have the sinoatrial node or the SA node. It is found in your right atrium. This is where the action potential originates and functions as your pacemaker. It is or it does have a large number of calcium channels. So the path of the action potentials through the heart. So first you have your SA node, sinoatrial node, and then going to your AV node or the atrioventricular node, and then passing to the AV bundle or the atrioventricular bundle. And then you have the right and the left bundle branches, and then your Purkinje fibers. Okay? So the Purkinje fibers are specialized conductive myocardial cells with few myofibrils that promotes the rapid conduction of the impulse through the ventricles, and they are larger than the normal myocardial fibers. And then what you call now, or what you see here now, is also we have what we call the bundle of His. Okay? So the bundle of His is a collection of heart muscle cells specialized for electrical conduction that transmits the electrical impulses from the AV node, this one from the AV node, to the point of the apex of the fascicular branches via the bundle branches. Okay. And then we have the Bachmann's bundle. Bachmann's bundle is a branch of the anterior internodal tract that resides on the inner wall of the left atrium. So this is the conduction system of the heart. So how does it happen? So first, action potentials originate in the sinoatrial node here. Okay. and travels across the wall of the atrium from the SA node to the atrioventricular node. So this is the atrioventricular node. And then next, action potentials pass through the AV node and along the atrioventricular bundle. This is the atrioventricular bundle, which extends from the AV node through the fibrous skeleton into the interventricular septum. Okay. And then the AV bundle divides into the right and the left bundle branches, and action potentials descend to the apex of each ventricle along the bundle branches. And then action potentials are carried by the Purkinje fibers from the bundle branches to the ventricular walls. So that's how the conduction system happens in your heart. So an electrocardiogram, it is actually used to record the electrical waves in the heart. It is used to diagnose cardiac abnormalities. You can use electrodes to be able to measure this electrical signals. It contains the P wave, the QRX complex, and the T wave. So this is actually a tricky concept or knowledge that you should actually know, no? Nung sa med school, medyo mahirap tong intindihin. Ito yung nakikita nyo sa mga electrocardiogram. Kung meron kayong kamag-anak or lolo or parents na nag-electrocardiogram, ganito nyo sila usually nakikita sa papel, di ba? So you have the P wave. So this is the P wave. The P wave is the depolarization of the atria. So the QRS complex, this one, QRS complex, it is the depolarization of your ventricles. So it contains the QRS wave. And then the T wave, it is the repolarization of your ventricles. So, kapag ka nagkaroon ng kumbaga disturbance dito sa mga complexes na to, of course malalaman mo na kapag ka ang may problema is si P, it's a problem on the atria of the heart. Kapag ka naman QRS complex or the T wave, of course it is already it can denote that you have problems when it comes to how your heart pumps in with the structure of your ventricles. So this is the normal versus abnormal ECG. So a normal heartbeat would actually look like this. But if you check on the fast heartbeat, kung titignan nyo yung itsura nila, masyadong dikit-dikit, di ba? Kumbaga dikit-dikit yung depolarization and repolarization of your ventricles. And then for slow heartbeat naman, ayan, medyo magkakalayo sila. Okay? And then kapag ka-irregular heartbeat naman, tingnan nyo, magkakaiba yung spacing nila. So that's how you actually read your ECG. Okay, so for the P wave, again, it's for the activation of your atria. The QRS system is the activation of your ventricles. And then, T wave is for the recovery of your ventricles or the repolarization. So, we have here what you call your ECG and or EKG, ischemia, injury, infarction. So, when you say infarction, ito yung heart attack, no? So, infarction are the different types of the damage due to the myocardial infarction. They have different manifestations on the EKG. So, kapag if there's an injury, the ST segments usually elevate within minutes of the onset of the cardiac chest pain. So, kung makikita nyo, hindi siya yung normal na ST na na wave. Kapag ka naman may ischemia, T-waves invert fully by 24 hours. So, imbes na magkaroon ulit ng depolarization, kumbaga ang nangyayari is that yung T-wave lang, no, hindi na umaakyat ulit to repolarize or depolarize. And then acute infarction, this is pathologic. Q waves around negative 0.3 seconds or 1/3 height of the QRS begin to form in 1 hour. So, nakikita nyo na napaka deep or napakababa nung inyong Q complex or the Q waves. So, it would denote an acute infarction. So, for all infarctions, so the ST segments are normal but Q waves remain forever. Okay, so ito yung mga nangyayari sa mga dati nang naka-experience ng heart attack or myocardial infarction. Okay, so that's how you read your ECG results. So the cardiac cycle, so the heart uh, is two side-by-side pumps. You have the right and the left pumps. Of course, the atria are the primer for the pumps and the ventricles are the power pumps. So the cardiac cycle is a repetitive pumping action which includes contraction and relaxation of your heart. So the cardiac cycle, it is where when the cardiac muscle contractions produce pressure and changes within the heart chambers. The pressure changes are responsible for blood movement, and blood moves from areas of high to low pressure. So we have what you call your atrial systole, which is the contraction of the atria. You also have the ventricular systole, which is the contraction of your ventricles. And then you have your atrial diastole or the relaxation of the atria, and the ventricular diastole, which is the relaxation of your ventricles. So if you're familiar when it comes to checking the blood pressure, you will always hear about the systoles and the diastoles. Okay, so yun yung contraction and relaxation of your heart pumps. So this is actually how a contraction happens. Okay. So the ventricles causes pressure in the ventricles to increase almost immediately. The AV valves close in the first heart sound. The pressure in the ventricles continues to increase. And then next is continued ventricular contraction causes the pressure in the ventricles to exceed the pressure in the pulmonary trunk and aorta. As a result, the semilunar valves are forced open and blood is ejected into the pulmonary trunk and the aorta. Okay? So, this one, yung susunod. So, after the third part of the contraction, so at the beginning of the ventricular diastole, the ventricles relax and the semilunar valves close, which is the second heart sound. So, yung first heart sound, actually guys, ang turo sa amin nun, it's lub-dub, okay? Kapag tatanungin daw kung paano ba ang tibok ng puso, it is usually denoted by the sound of lub-dub, lub-dub. So, the first sound is lub, and then the second heart sound would be dub. Okay, lub-dub. So, fourth phase is that the AV valves open and the blood flows into the ventricles. The ventricles fill with approximately 70% of their volume, and then the atria contract and complete the ventricular filling. So, yeah. So, this is actually the events of the cardiac cycle. So, as you see here, we have representations of the different complexes, the PQRST. Okay, you also have here how you check on the systolic pressure. You also have here the left ventricular volume and of course the sound frequencies of the first heart sound to the second heart sound to the third heart sound. Okay, so usually kapag nagte-take ng blood pressure, 'di ba guys, yun yung pinapakinggan para malaman kung ano yung pinakamalakas na pitik kasi yun yung systole. And then yung pinakahuling pitik is that's your diastole or the relaxation already of your heart muscle. So doon nalalaman yung inyong blood pressure. Okay? So ayan. So, makikita nyo dito yung period of isovolumic contractions, the period of ejection, when does your heart relax, and then you have the passive ventricular filling, and then the active ventricular filling again. Okay? So again, for the heart sounds, so we use the stethoscope to hear the lung and the heart sounds. So the first sound is lub and then the second is dub or dub. Sounds result from opening and closing of the valves and murmurs are due to faulty valves naman. Kapag may mga naririnig na pa konti-konting mga ibang sounds, okay, those are what you call the murmurs. So, the location of the heart valves in the thorax. So, ito yung kapag para malaman nyo, di ba, hindi naman pwedeng yung stethoscope idikit talaga sa pinakapuso ng tao. So, Superficially, para malaman mo kung saan yung dapat na pinapakinggan, okay? Kapag nag-use tayo ng stethoscope, dapat medyo alam natin yan yung mga spots. Okay, so the surface markings of the heart in an adult male. So the positions of the four heart valves are indicated in the blue ellipses. So yung bandang nasa gitna. And the sites where the sounds of the valves are best heard with stethoscope are in the pink circles. Ayan. So kung nakikita nyo, medyo dito sa may bandang chest. And then, yung isa is medyo sa baba naman ng inyong, or sa baba at gilid ng breast. Okay, so those are the best spots to hear the heartbeat. Okay? So, for the regulation of the heart function, we have what you call your stroke volume. So, it is the volume of the blood pumped per ventricle per contraction, and the normal would be around 70 ml per beat. And then we also have the heart rate. This is the number of the heartbeats in 1 minute. So normal would be 72 beats per minute. And then cardiac output. This is the volume of the blood pumped by a ventricle in 1 minute. So that should be 5 liters per minute. So how do you compute for your cardiac output? That's cardiac output equals your stroke volume times your heart rate. Okay? So, for the intrinsic regulation of the heart, it is actually the mechanism contained within the heart. So, you have what you call your venous return. This is the amount of blood that returns to the heart. And you also have what you call your preload, which is the degree of the ventricular walls are stretched and at the end of the diastole. And then you also have the venous return, the preload, the stroke volume are actually related to each other. And we have what you call the Starling's law of heartbeat of the heart. It is the relationship between preload and stroke volume. It influences the cardiac output. So for example, exercise increases the venous return, the preload, the stroke volume, and your cardiac output. So the afterload naman is the pressure against which ventricles must pump the blood. So next is the extrinsic regulation of the heart. So it is the mechanisms that happening external to the heart. So these are the nervous or chemical regulations. So here you will see how the regulatory centers and chemoreceptors are um, sending signals to the heart. So first here you see in number 1 are the sensory neurons that carry action potentials from the baroreceptors of the cardioregulatory center. So the cardioregulatory center is right here. Okay, so you have here the green signals, okay, or the green lines that represents the sensory neurons, okay, that carry the action potentials. And then chemoreceptors in the medulla, medulla oblongata, influence the cardioregulatory centers. And then the cardioregulatory center controls the frequency of action potentials in the parasympathetic. Okay, here, the red one, the parasympathetic neurons extending to the heart, and the parasympathetic neurons decrease the heart rate. And then the cardioregulatory center also controls the frequency of action potentials in the sympathetic, so the blue lines. Okay, so those are sympathetic reactions. So the sympathetic neurons increase the heart rate and the stroke volume. So, and then cardioregulatory center also influences the frequency action of the sympathetic neurons extending to the adrenal medulla. So in here, the sympathetic neurons increase the secretion of epinephrine and some norepinephrine into the general circulation. So the presence of the epinephrine and norepinephrine increase the heart rate and your stroke volumes. So the nervous regulation or the baroreceptor reflex, so it is the mechanism of the nervous system which regulates the heart function. It keeps the heart rate and stroke volume in normal range. The baroreceptors monitor blood pressure in the aorta and carotid arteries that carry blood to the brain. and it changes in blood pressure, cause changes in the frequency of action potentials, and it involves your medulla oblongata. So this is the baroreceptor reflex. So again, let's start in here. So the normal blood pressure range. So kapag ka tumaas, okay, so there's always a homeostasis disturbance. So when the blood pressure increases, the baroreceptors in the carotid arteries and aorta detect an increase in your blood pressure, and the cardioregulatory center alters heart activity and decreases stimulation of the adrenal medulla. With this one, the heart rate and stroke volume decreases and the blood pressure decreases once the homeostasis is restored. Okay, but what if your blood pressure is decreased? What happens? The carotid arteries and the aorta detect a decrease in blood pressure, and the cardioregulatory centers alters the heart activity and increases the stimulation of the adrenal medulla. With this, heart rate and stroke volume increases to be able to restore your homeostasis, to go back to the normal blood range. Okay? So, chemical regulation, which is reflected by the chemoreceptor reflex. So, it is where chemicals can affect the heart rate and stroke volume. So, epinephrine and norepinephrine from the adrenal medulla can increase heart rate and stroke volume. So, excitement, anxiety, anger, can cause increase in cardiac output. Depression can decrease cardiac output. And then medulla oblongata has chemoreceptors for changes in pH and carbon dioxide. So also potassium, calcium, and sodium affect your cardiac function. So, okay. So this is now the chemoreceptor reflex when it comes to dealing with pH. Okay. So, kapag ka nag-increase ang inyong blood pH, what happens is that the chemoreceptors in the medulla oblongata detect an increase in blood pH, often caused by the decrease of blood carbon dioxide. So the centers in the brain decrease stimulation of the heart and adrenal medulla. In response, the heart rate and stroke volume decreases, reducing blood flow to the lungs, and then eventually the blood pH decreases and can be restored to homeostasis. But what if your blood pH decreases? What happens in the chemoreceptors in the medulla oblongata is that the brain increases the stimulation of the heart rate and adrenal medulla. In response, the heart rate and stroke volume increases, increasing the blood flow to the lungs. And then, once the blood pH increases, of course, homeostasis is restored. Okay? So, for the concept of heart attack, so heart attack, it is actually um, a situation wherein you will have a thrombus. Okay, so a thrombus is the blood clot that blocks your coronary blood vessels and causes the heart attack. And daily aspirin can prevent by thinning the blood. And then an infarct naman is actually an area that dies from lack of oxygen. Okay. So heart procedures, we have angioplasty. This is a procedure that opens blocked blood vessels. We also have the stents, structures that are inserted to keep the vessels open. And then you have bypass surgeries. This is a procedure that reroutes blood away from the blocked arteries. So these are the different types of heart diseases. So you have the valve disease, like normal. This is the normal valve, which is closed, but with valve stenosis, okay, you see there that there's an inflammation and hindi naglalapat yung mga enclosure ng inyong valves. And then you also have the aneurysm, which is, ayan, kapag sinabing aneurysm, may pamamaga dun sa mga vessels. Pag coronary artery disease, you have fatty deposits within your arteries. Okay? You also have your cardiac arrhythmia. This is disorganized electrical signals. So, ito naman, yung mga signals naman na dito yung nagkakaroon ng problema. And then you have heart failure because of dilated ventricles. You also have cardiomyopathy or the thickening of the myocardium. And then, of course, pericarditis. Okay? So